Do you frequently feel like your heart pains sometimes? Or notice your legs suddenly swelling for no reason? What if I told you that sometimes the real problem might not be your heart, but tiny helpers in your blood that aren't doing their job? One of these helpers is called protein C. It usually stops your blood from clotting too much. But when it's missing or weak, your body can form dangerous clots even when you're just sitting or sleeping. That's what happens in protein C deficiency. It's rare but serious and often silent until something bad happens, like a blood clot in the leg or lung. Think of protein C like a brake pedal in your blood's clotting system. Without it, the car your blood just keeps going and might crash, form dangerous clots. So what causes this missing brake pedal? Most of the time, it's handed down in families, like inheriting your mom's eye color or your dad's laugh. But instead of something visible, you get a gene that makes your body produce little or faulty protein C. This is called inherited deficiency. Imagine your body is a factory. The blueprint your genes has a typo, so the protein C machines can't make enough good products. Some people are born with one faulty gene, mild risk, others with two, high risk. There's also acquired protein C deficiency. It's not in your genes, but something else breaks the system. For example, bad infections, severe burns, or even certain medicines like warfarin, a blood thinner, can temporarily lower protein C levels. So it's like losing your brakes, either because the factory was built wrong or because someone unplugged it later. Now, how would you know if you are at risk? Many people with mild deficiency feel totally fine until they do not. Picture this. You have been on a long flight, sat for hours, and your leg starts hurting, turns red, and swells. That could be deep vein thrombosis, a clot in the leg. Or maybe you suddenly struggle to breathe. Could be a clot in the lung, pulmonary embolism. In babies with severe deficiency, something shocking can happen. Shortly after birth, they develop large, dark, spreading skin spots that look like bruises, but are actually clots under the skin, called purpurifulminins. Scary, right? But even simple things like getting a cut can be misleading. With this condition, your blood might clot too much inside, but some treatments can make you bleed more. So it is a dangerous balance, like trying to fix a leaky pipe with too much glue, only to block the whole pipe. How do doctors find out? They don't just guess. They ask, did your family ever have unusual clots? When were you first affected? Then they draw blood, usually not once but twice, weeks apart, to check protein C levels. Why twice? Because if you're sick or on certain blood thinners, the result might be low even if you're not truly deficient. So testing at different times gives a clearer picture. Once confirmed, the treatment depends on the situation. If you already have a clot, you get anticoagulants, blood thinners like heparin or warfarin, but carefully because warfarin can worsen things early on. For high-risk people, like before surgery or childbirth, doctors may suggest preventive blood thinners. Think of it like putting on seatbelts before a bumpy ride. In emergencies, especially in babies with purpurifulminins, they might give protein C concentrate, like borrowing brakes from someone else until your system starts working. Can you stop it before it starts? If you inherited it, you can't change your genes, but you can manage risks. Avoid long periods of sitting still, like during long drives or flights. Get up, walk every hour, and drink water. Wear compression socks if your doctor recommends. Avoid birth control pills or hormone therapy that increase clotting. Talk to your doctor first. If you know you're at risk, wear a medical ID bracelet. That way, if you ever get into an accident or become unconscious, doctors know not to give certain drugs. And if you're planning surgery or getting pregnant, two high-risk moments, talk to a hematologist. Prevention isn't about living in fear, but about making smarter choices, like checking your car's brakes before a long trip. Good news, science is moving. Researchers are working on longer-lasting synthetic protein C that could be given less often, maybe even once a week instead of daily. Gene therapy is also being studied. Imagine fixing the faulty blueprint in your cells so your body makes normal proteins see all by itself. Sounds like sci-fi, but early trials in animals show promise. Also, new blood tests are being designed to spot clotting risks earlier, even before clots form. Some hospitals are now using genetic screening for people with unexplained clots, helping not just the patient, but their whole family. The future, maybe one day, a simple shot or pill could reset your body's clotting balance. No more